Hey, good morning, everybody. Here we go again. I don't, I kind of stopped waiting for people to join since my son reposted one of these videos and said go to the 7-minute mark to wait, or for me to get to the actual thing I'm going to talk about. Hi, Eileen. So people join as I talk. Hey, Sarah. So what we're going to talk about is, of course, one of my favorite topics, hormones. So the sunshine hormone is kind of the name that's given to vitamin D. And so all we hear about is bad stuff with sun, right? Oh, you're going to get skin cancer, you're going to get melanoma, etc. So we're going to talk about good things, specifically vitamin D that sunshine can provide you. The problem is when you look at the statistics and what's going on in the last several years, well, more than that, more than several years, what you find is that sunshine might not be enough. Hey, Beth. Hey, Chris. So vitamin D deficiency, depending on how you look at it and how it's diagnosed, is kind of an epidemic. Okay, so we've heard for about 50 years, I mean, since I was a teenager, basically, so, and I'm 59, so, well, maybe 40 years, stay out of the sun. Put SPF on, 30, 50, all that. I talked to somebody yesterday, or interacted with somebody yesterday, who has an autoimmune disease and has a rash from the sunshine despite even wearing SPF 50 sunscreen. So vitamin D, hey Jennifer, Christy, boy, you joined. Hey Linda. So vitamin D is a fat-soluble vitamin, is what they call it, but it's really a hormone because it's related to cholesterol. Okay, so what happens is lack of sunshine exposure. So, hey, Joey. So, lack of sunshine exposure that we've been pounded into our heads for years has led to a significant increase. Some say up to like 2/3 of Americans that have a vitamin D deficiency. And we'll talk about lab values as I get to that part. I actually have an outline for this, so I'm going to go flying off on my tangential thinking. My ADD takes over. So, like most hormones, cholesterol is the base. So, most of the hormones, the adrenal hormones, vitamin D, and cholesterol have a similar chemical structure. And remember, I have a chemistry degree. So when you look at them, it makes sense to me. I could show you the chemical composition or the chemical formula for vitamin D and cholesterol and show it to you. Might not mean anything to you, but it means something to chemistry people anyway. So vitamin D coming from cholesterol, related to cholesterol, leads to a whole other topic that I'll do on one of these Facebook Lives about cholesterol. I wrote a big, huge article probably 4 months ago about the myths of cholesterol. You hear about cholesterol as it's bad, and all you hear about sunshine is it's bad. And if you didn't have cholesterol, you would die. And most of it's made in your body. 80% of it's made in your body, so you're not eating it. Hey, good morning, Christy. So ultraviolet rays from the sun convert cholesterol. And you can get cholesterol from eating, and you can get it from sunshine exposure from the ultraviolet chemical reaction that occurs. Okay, so the active form of vitamin D is 25-hydroxy vitamin D. Hey, Tammy, what you're eating is vitamin D3 from animal sources, and if you're eating plants, you're getting vitamin D2. So once it gets in you, it has to be formulated into its active form, and that's done by your cells. Okay, so what they found is that virtually all cells have vitamin D receptors that can help convert the vitamin D3 and vitamin D2 into 25-hydroxy vitamin D. It used to be thought that the only conversion that occurred was at the kidney, but as they study more and more, most cells all throughout your body have the ability to convert vitamin D to its active form. once it's converted, it circulates. So it's in your bloodstream and can interact with those receptors. So cells that need it will convert or pick it up on the cell membrane. Hey, Stacy. Okay, so what everybody knows about vitamin D is bone health, right? Okay, drink your milk. Your mom told you that. Drink your milk. Source of vitamin D keeps your bones healthy. It has to do with calcium and phosphorus balance, two metallurgic ions in our body, and calcium, phosphorus, vitamin D, estradiol, the estrogens that circulate, all have to do with bone health. Okay, what you may not know, so I said what you may or may not know about vitamin D is all the other things that vitamin D is associated with as far as keeping you healthy, um, and potentially just making you feel better. Okay, so it is involved in all mitotic cell division, which is occurring in your body all the time. So vitamin D is necessary for that. It has to do with your immune system and its response to inflammation. So we talked about vitamin D as one of the immune system builders during this pandemic. And most people are not optimal on vitamin D. Once again, I'll get into that when we go over the lab values that should be looked at. It's also involved in insulin secretion and glucose levels in your blood. It's involved in blood clotting, and it's involved with normal blood pressure. Okay, so vitamin D deficiency has been cited as 30 to 50% of United States citizens, and we'll focus on the U.S. We go throughout the world and talk about all that. However, since we live here, we'll talk about the U.S. So one study I showed, we'll talk about later, that's going to blow your mind. This is how I got people to start taking vitamin D. Is that up to 2/3 of Americans have suboptimal vitamin D levels. Okay. So why are our vitamin D levels going down? Because they've been going down, and when you check it, I mean, I check these all the time. Hey, Drew, how are you? You will find that most people aren't deficient by a diagnostic criteria, but they are suboptimal. Okay, so we're staying out of the sun. We've been doing that for 30, 40 years, doing our SPFs. And really, your skin cancer risk from sun exposure, I think, peaks at age 15. So if you've got a bad sunburn by the time you're 15, that's the risk. Not so much later in life. I mean, the skin's hard, or the sun is hard on your skin. If you don't believe me, look at a person's chest who's older, and then look at the skin on their hind end, unless they sunbathe nude. So the skin is different. Sun-exposed skin looks different. Hey, Terry. Okay. The other thing is obesity rates have climbed. That's the subject of a whole nother deal, and insulin resistance. But vitamin D needs to be circulating, and adipose tissue or fat stores it. So it's not as available to you if someone is heavy. Okay. And then we have less dairy consumption. So we got a lot of people that are lactose intolerant, so they just avoid dairy altogether. There's plenty of people that just can't handle it. And so they will tend to be vitamin D deficient. Okay, so the lab tests, it's hard to measure a vitamin D2 or vitamin D3 level. So the easiest and most cost-effective way to check a vitamin D level is to measure 25-hydroxy vitamin D3, which is the active vitamin. And here we get into the normalcy. Remember I talked about the bell curve, Gaussian distribution that you learned in high school. So normal lab values for vitamin D in almost every lab that I've ever looked at, this is one of them that doesn't vary per lab, is 30 to 100 nanograms per cc. So 30 to 100 is the bell curve. Anything lower than that is in the less than 2.5 percentile. Anything higher than that is in the 97.5 percentile or higher. So what's a good level? Okay, so if you get your vitamin D level checked and it's 30, most, not all, functional medicines doctors get this. Most people will tell you you're normal. The FDA will tell you you're normal at 30. Okay, and we're going to talk about what that means. Orthopedic people who deal with bones, of course, at least from talking to the ones that I know, think that they want vitamin D levels greater than 50. Okay. And if you look at age management research, the optimal vitamin D level is 65. So it's right there, sort of in the middle, that 50th percentile. Hey, Rob. So that's the goal. That's what I've always shooted for. Let's get you around 60 to 70, 65. Orthopedic doctors and surgeons are happy with a vitamin D of over 50. Okay. They start calling a vitamin D level normal at 20. So 20 to 30, if you look at the diagnostic manual, is called vitamin D insufficiency. To get a diagnosis of vitamin D deficiency, you have to be less than 20. And we're going to talk about the health effects of having a vitamin D level less than 30 when I talk about this study that I started telling them about patients about that would get them to take their vitamin D. Okay, so what are the signs of vitamin D deficiency? Well, rickets, but nobody gets rickets anymore, hopefully. So it's easy to confuse with other conditions, specifically chronic pain. So people can get, with vitamin D insufficiency or less optimal vitamin D, you can get bone pain, you can get muscle pain, you can get just joint pain in general. So a lot of these people that really just need some vitamin D get diagnosed with fibromyalgia and myalgia, chronic pain syndrome. You can get muscle weakness from vitamin D, suboptimal levels, osteomalacia you can get. And then there's a fair number of health effects for vitamin D insufficiency just by itself. And I find those symptoms even with people that are in their low 30s. So 30 to 40, you'll see people with chronic pain and inflammation. If you correct their vitamin D, that seems to get better. It just gets better. Okay, the other one is seasonal affective disorder. So people with a vitamin D level less than 30 tend to be depressed or they have a depressed affect. I always hesitated when I was practicing to diagnose anybody with depression because it can make getting life insurance rates or even getting life insurance because you're considered to have a chronic illness, right? So adjustment disorder with depressed affect or just an adjustment disorder. You're going through a bad time, et cetera, like we're all doing. And, you're going to be a little bit low in your affect, okay? So those people are frequently misdiagnosed with depression. And think how many people you know that are on antidepressives, which are, rewiring their brains. And then think how many people that you know that have been diagnosed with bipolar disorder, and all they might have is a vitamin D level less than 30. Okay. Hypertension is more common with deficiency. Periodontal disease, looser teeth. Good morning, Wendy. Hey, Susan. So loose teeth can be from vitamin D deficiency. Okay. And then compromised immunity with repetitive annoying infections. Now, COVID-19 is not just annoying, but common colds and all that. Your immune system just isn't as efficient. Hey, Sonia, as when you have a good optimized vitamin D level of greater than 50. Okay, and then specific to women, since I was a gynecologist for 30 years, infertility has been associated with vitamin D, with suboptimal vitamin D levels. Now, it seems goofy that you would just give somebody vitamin D and they would get pregnant, but it has been researched and looked at. Polycystic ovary syndrome patients tend to have insulin resistance, and they've been shown to have vitamin D deficiencies. And one of the symptoms or problems with polycystic ovaries can be infertility. Premenstrual syndrome, higher in vitamin D levels, less than 30. Dysfunctional uterine bleeding, so dysfunctional uterine bleeding is any cyclic bleeding that's different or it's abnormal. So 2 periods a month, longer menstrual periods is, the typical menstrual cycle is menstrual period bleeding is 3 to 5 days. So among other hormone levels to check with women that have abnormal uterine bleeding is a vitamin D level, easy to fix. Okay, and it's very common in menopause. So elderly people do not convert vitamin D3 in their body by ultraviolet light as well because of changes in skin related to andropause and menopause. So just being 60 or older, you tend to be vitamin D or less efficient at vitamin D conversion. Okay, those at risk. So people at risk, those that don't get much sun, okay, people that live north of the 35th parallel. Okay, so I had to look that up. People that live north of the 35th parallel. Morning, Ross. Okay, so that means the southern border of Tennessee and North Carolina, and the northern border of Mississippi, Alabama, and Georgia. So that's the 35th parallel. People living north of that, I don't know what the distribution of the population of the United States is north of that parallel, but from November through April, the sun is not strong enough to convert vitamin D in their bodies. Okay, so too much skin covered by clothing. So the autoimmune person I talked to yesterday, she has to wear long sleeve shirts all the time. If she's exposed to the sun, she gets a rash. So we're working on trying to figure out how to downplay her autoimmune symptoms. She's already on all the medications, including hydrochloroquine, for management of that autoimmune disease. People that are in the hospital, nursing homes, etc., they tend to be vitamin D deficient. People that use tons of sunscreen tend to be vitamin D deficient. People that live in air polluted cities, so we're assuming Los Angeles is probably improving their vitamin D levels as their air quality has improved so much in the last couple of months. People that are greater than 60, people that are obese because of that storage of vitamin D in adipose tissue, and then patients that take medications that reduce cholesterol. How many people you know that's on Lipitor or Crestor or whatever cholesterol lowering medication? So that has been shown to reduce vitamin D levels in as well as coenzyme Q10 levels, and we'll do a whole thing on coenzyme Q10 down the road. Okay, and then chronic kidney disease and patients that have liver failure, because the liver has to do with vitamin D conversion as well. Okay, so I keep telling you about this study, and I was thinking it was 4 years ago, but as you get older, obviously years go faster. I'm thinking most of you know that if you're about as old as me. So this came out in 2014 from the University of California, San Diego. And what they looked at was a systemic review of 32 studies on vitamin D levels correlated with mortality. What they found on 556,583 people at an average age of 55, that if their vitamin D level was less than 30, they had twice the risk of premature death from all causes. So when I was practicing and telling people, look, your vitamin D is 26, you have a 2 times likelihood of dying from everything, they would take their vitamin D. Okay. And these, I think I mentioned this couple that have a house in the Bahamas, someplace in the Caribbean, who are always tan. And one of the things they always complained about was fatigue. So chronic fatigue is associated with vitamin D levels less than 30. So they were in the office. I drew, it was a married couple. I drew their blood, their vitamin D levels with perfect tans. They went to the Caribbean every 6 weeks. Was 11. His was 11. Hers was 12. So high dose of vitamin D, I put them on 10,000 units a day. And lo and behold, their chronic fatigue went away. And they were in their 40s, they were young. Okay, so the lower levels were found in those 556,000 patients, 2/3. Okay, so that's 66.6%, right? Okay, 2013, University of Kentucky found that vitamin D levels less than 30 damaged your brain. So that should get your attention, right? You're damaging your brain. Okay. They've also been, lower levels have also been linked to Alzheimer's, dementia. So there's the brain thing, right? And then cardiovascular disease, plenty of research on that. Increased breast and colon cancer rates. So this is always levels always levels of 30 or less than 30, I guess. So remember the normal range, normal 30 to 100, ideal 65. Age management research. Okay. So how do you optimize vitamin D levels? Okay, so 15 minutes of sun per day is recommended. Okay. Uh, Plus it makes you feel good, right? And then you delay bathing. So get a little sweaty, wait for your body to start making vitamin D. And cholesterol will be converted for about 48 hours after sun exposure. So I'm not saying you don't have to skip bathing except every 3 days, unless that's your thing. But if you can be out in the sun, get a little sweaty for 15, 20 minutes a day, and then avoid getting in the shower or the bathtub, that would help. Okay, chlorine in swimming pools strips your natural skin oil off and inhibits vitamin D conversion from the sun, from the ultraviolet light as well. The supplements is how most, so there's dietary, we talked about plants and animal sources. And so you can get, let's see, I had this down. So dietary sources from plants, mushrooms, vitamin D2. Okay, so that's the plant-based one. From vitamin D3, organ meats, beef, skin, fat, eggs, pork, mutton, goat. Those are all good sources of vitamin D3. Okay, and then if you can't get your level over 50 at least, so Wendy says optimize vitamin D level more than 30 or some more than 50. That's true. I'm saying 65, and the orthopedic surgery people I know don't argue with me. Hey, Steph, they don't argue with me. They like that level. They're just after over 50. Okay, so if you take supplements, you can get them from several different ways. So they make transdermal application vitamin D. They make shots. You can take it by injection. Women's International Pharmacy has an injectable vitamin D. Most people take it orally, and you want to take it orally with a fatty meal because it's fat soluble, right? So you get better oral absorption. Well, here's the interesting thing that came out, I'm going to say 2016, I think. So the FDA recommended daily allowance or recommended amount of vitamin D is 600 international units a day. And they increased that in December of 2016 from 400. A lot of people think 200 international units a day is good. And all the vitamin D researchers and papers that I've read all recommend about 4,000 international units a day for maintenance. If you're low, in the low 30s, 10,000 units a day for 3 months will usually get you over 50, not always. I had a 36-year-old woman in Oklahoma City whose vitamin D level was 8. I put her on 10,000 units a day for 3 months, and her vitamin D level came back 15. So I put her on 15,000 units a day for 3 months, and it came up to 30. So she had to take a whopping huge amount of vitamin D just to get to, I think the highest I ever got her was 42, and she was taking these massive amounts of vitamin D. Probably should have given her shots. That might have worked better. Okay, so the way you do that is you get your level tested. Most of us are going to have a low vitamin D level. So I take 5,000 units a day, and my last vitamin D level was 67. And I was never, I'm trying to think, I think I was 32, took 10,000 units and got up to 60. And so I went back to 5,000. I've managed to maintain that. Hey, Zach. So what are the benefits? What are the benefits of a good vitamin D level? Well, you would probably make the same list of all the stuff that the deficiency causes. So you may modify or you may prevent. Of course, those statements are not reviewed by the FDA. But certain cancers, so we talked about breast and colon, cardiovascular disease, hypertension, diabetes, multiple sclerosis, rheumatoid arthritis, inflammatory bowel disease, so Crohn's and ulcerative colitis, periodontal disease. I don't know if dentists talk about vitamin D. I've never talked to my dentist about a vitamin D level. Autoimmune disease, chronic pain, and the last one, influenza. Okay. Not a whole lot of information yet on SARS-CoV-2 and vitamin D, but boosting your immunity at this time seems to make sense, right? Okay, so how do you get it tested? Well, you can ask your doctor and they'll do it maybe. If they don't, there's a way to do it. So I affiliate with labs, I affiliate with supplement companies, and I find good prices, and I'll put you a link up for your own, for a test and a supplement, because right now they're all on sale. You can get a vitamin D 25 hydroxy level right now for $35. Okay, it's usually at a commercial lab about $69. So you can do direct labs from Quest and LabCorp. Those are the two biggest commercial big box labs in the country. You can do it. They're always way more expensive than some of the other direct access labs. So for $35.25, you get a hydroxy 25 hydroxy vitamin D level, and that kind of guides you as to what's your supplement if you need it. Some of you wouldn't, what you need for a supplement. If you combine that, if you just want to check your health, you can get a fasting glucose level, kidney function, electrolytes, liver function, lipid panel, and a complete metabolic profile for $26 right now. Hi, Jill. Okay, so nice little package for $61.50 that's on sale. So I added this up from Quest. Like if you walked into Quest and said, "Ooh, I want this checked," this would be your out of pocket. So for those tests, it'd be $183. So kind of a nice little deal as far as labs and all that. And then vitamin D supplements are relatively inexpensive. You do have to read the label because most of them look alike. They're little yellow gel capsules basically, and they come in 1,000, 2,000, 4,000, 5,000, 10,000. There's a liquid form of 10,000 that I know, but most of the time you're looking at I think the 5,000 units for 60 is like $9. So it's not a ridiculously expensive thing, and most vitamin D researchers say 4,000 is where you should be for maintenance after you get it up to that optimal level. So that's what I got for this morning. This is a little bit controversial, like almost everything I talk about. So vitamin D people, you know, there's papers that say if you take too much vitamin D, all this can happen to you. Remember, the upper limits of normal, the 97.5 percentile level is 100. And most people at 5,000 are going to come in over that 50 nanograms per cc, which the orthopedic surgeons want. Okay, so that's it for today. For Friday, I'm getting a lot of information right now about COVID-19 suppression of thoughts. And doctors and medical professionals and scientists being eliminated from YouTube and various other social media things where they're just chopping their stuff down and getting rid of it. You know, violates the First Amendment. I'm not sure exactly how that's happening or why it's happening or what the agenda is. But I'm going to spend the next couple of days watching, looking, reading, and all that, and I'll kind of give you the updates of the controversy that's occurring with physicians and scientists that are trying to get to have a dialogue. And we, you know, dialogues are fine, right? Okay, so y'all have a great Wednesday. I got in just at 30 minutes like I try. So I will talk to you Friday at 9:30 and we'll do some controversy, even more than this one. Okay, see y'all later. Peace and health to you all. Bye.